Hey there everybody, it's Irene Lyon, and today I've got a very special guest. This is Elinor Silverstein, and she is here to teach us a little bit about the guts. And how would you title this little exploration that you're gonna bring us through?
This is an exploration of our swallowing tube, all the way down to the elimination tube.
Perfect, like that. So if, for those of you that want to learn more about Elinor and what she does and how we got to meet each other, I will post somewhere, either below or in a link close to this video, how that happened. And it's a longer interview and it's got lots of information, so definitely watch that after this, or you could watch it before it. But we'll head into a movement exploration lesson right now. So you ready, Elinor?
I am.
All right.
So I'm going to take you through a little bit of my program called the Gut-Brain Connection. And we're going to start with going through the mouth and take the whole tube system, going through swallowing all the way through all the organs that it takes through till the final exit and completion. And I'm going to take you on it as a little bit of a travel tour. So are you ready to join me?
Yeah. Oh, one question, Elinor. When
Yes.
people are watching this, if they feel a need to stop or pause because of what would be something that someone might start to sense that might signal that they have to take a break in case they don't know, based on your experience?
If you feel too much of a pull happening that might make you feel physically uncomfortable, it's so gentle and so light that I would say the most people ever have felt is a little bit of a pull in the throat, which actually is a good thing because we're actually starting to connect and feel the gentleness of our enteric nervous system, which is a blessing to get in touch with this. If you feel a little bit anxious, allow yourself to breathe and give yourself the gift to listen to yourself to take it easy.
Perfect.
That's, I would say, one of the most important things,
Cool.
because you're following through the vagal nerve complex and all of that in there, and you may be touching to that. And if that happens, you can take it easy, take a break, or you can even touch yourself more gently.
Perfect. Thank you.
Okay.
Great. Let's get started.
All right. So sitting in your chair, hold on, I'm looking. Okay, so sitting in your chair, allowing yourself to be comfortable and relaxed. And just notice how you're breathing. And how are you easily sitting in the chair and breathing, and maybe even a little bit of an awareness of one swallow.
So to actually make that happen?
Yeah.
Okay.
And now take your hands and explore around your mouth, around your lips is a beautiful ring muscle here called the buccinator, and just explore around your mouth, making a gentle touch that's maybe the weight of a grape in your hand.
Okay.
That's soft, letting your shoulders hang, letting your elbows be soft, letting your neck be soft, your eyes can be soft. If you would like, you can follow me, or you can close your eyes and do it with your eyes closed. It's your choice, because you can always come back and watch it with your eyes open. You can always go back and do this any way you choose. You can do this lying down. I often do this in bed, so, or if I'm standing in line at a grocery store, just a little bit of following through. So it's really nice everywhere you are. So it's just following a little bit around the mouth, knowing that the beginning of your life happens from your mouth with your sucking. As soon as a baby's born, the first thing that the baby does right?
Yeah.
And we know if there's an issue, they don't. So we help them.
Mm-hmm.
And so you follow around here, and now let your hands down and just notice, go in your mind's eye to see inside your mouth. See inside the roof of your mouth. Your tongue, your cheeks, the gums and jaw where your teeth are connected into. And all the way down into the back of your throat. And now bring your hands back up. And as if your finger pads had cameras, in all of them, let your mouth be gently open, that the cameras see all the way into your mouth, but your mouth is hardly open. There's super wide angle lens and narrow angle lenses on your finger pads that see inside your mouth, going past your tongue. With your finger pads, with these cameras, looking down into your throat, where it goes to the back of your throat and down through your throat and neck. And you can follow the lens with your fingers looking down.
Now, am I touching, Elinor, or is
You
it...
don't have to touch.
Okay.
That is the beauty of this work. I do teach this touching. I teach it not touching. I teach this over a period of like a few hours in multiple different ways. So I'm going to give you an exploration in a couple of ways in this one.
Perfect.
So you're seeing with your camera on your pads. In this first exploration, looking through your throat, and you're looking now, you saw down your mouth, now you're looking in through the tissue, into the tissue through the front, and you can allow yourself to see the outside of the tube systems and the inside. You're on a travel tour of your swallowing and digesting system, and you're following it down the esophagus. The trachea is in the front, the esophagus is behind, and you start to follow it down as with the pads, with these cameras, and you follow it down until you get to the bottom of your rib cage, and that a slightly tad over to the left is the beginning of your stomach. And you can just follow it, and now touch it, the weight of the skin of a grape.
Great.
The weight of the skin of a grape.
So very gentle.
So gentle. How thin is the skin of a grape?
Thin.
That's how thin you're touching, and you're saying hello. You're welcoming and inviting yourself to get to know where your organs are. And so we're not listening yet, we're just following them. The stomach is a little to the left, and the stomach that's a little more. So I would say go down the esophagus and just a tad over, maybe a half an inch. Yeah. And down here is the stomach, and the stomach makes hydrochloric acid that breaks down the food, and at the bottom of the stomach is a valve where the food that is mixed with the hydrochloric acid starts to drip. Plop, 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 little bits of beginning of digested food into the beginning of the small intestines. Just noticing that. And now, a tiny bit over to the right, under the bit of the rib cage, is the gallbladder, which hides behind the rib cage, behind the liver. And a little bit over to the left, look how equal we are on one side and the other. Little over to the left, starting somewhere around here, going all the way on your left, that's your right. So go over onto your left is your pancreas. Your pancreas is about 6 to 7 inches long, really large, and your gallbladder is very small, just a couple inches long. But the tube that goes from the pancreas and the tube that goes from the gallbladder meet together into one tube.
Okay.
And that one tube meets right into the beginning of the small intestine.
So they all converge.
Yeah. It's kind of like a plexus, you know? You have the stomach emptying out there, the gallbladder and the pancreas meet together into one tube and go right into that same place.
Okay.
What a great job that they do when they work in harmony with each other. And feel, just noticing, welcoming that touch with the camera to feel the small intestines that are all folded up somewhere in the middle, all around here. Let's see if we can. Okay. Can you see my belly?
Yep.
And my head?
Oh yeah, we're good.
Okay. So you follow around, all around the intestines, saying hello.
Hello.
Hello. Just listening. And use your finger pads as something so gentle, soft, caring, thoughtful, and the ability to listen for information. Even though that's not what we're doing yet, we're using that as a tool to see. And then the intestines that are all folded up along here in the middle go down a couple of inches below the belly button and a couple of inches to your right. And right around there is where the small intestine meets the beginning of the large intestine. And that's another valve. And that's called your ileocecal valve. God bless our ileocecal valves, because it closes and it opens. And it closes and it opens. And it's a beautiful ring-like muscle. If it stays open, everything that's in the small intestine will keep coming through. So, and if it stays closed too long, what's in the small intestine doesn't get through. So we want to keep it doing its desired thing to close when it's supposed to and open when it's supposed to. And we don't have to know what that rhythm is. But when we touch ourselves in that way, we give the space for our body to create its own miraculous rhythm.
Got it.
And that is where the beginning of the ascending colon is. So you're going to follow, just gently following up a straight line on the right side called the ascending. Ascending means to go up. Ascending colon. And you can follow with the pads of your fingers the outside realm of the ascending colon Or you can even, with your pads, go seeing inside your ascending colon.
So visualizing the inside tube.
Inside also. Inside and seeing the outside. Sometimes people get a little, they have pain here, and you never know what that might be. I find that when we see the outside and we visualize and imagine that we're touching the outside, that whole area goes, ah. So that's why I'm suggesting, see if you can do both.
Got it.
Notice the inside, but it's very important to really notice the circumference, the whole outside of that musculature.
So having this visual that there's like, as I know, but there's 3-dimensional structure, which we forget because we don't see it like our arm.
Exactly.
Okay.
Exactly. That's why it's like, go inside and see the whole 3-dimension going around it, go inside of it, stand on the outside, look inside, be on the inside, look up, look down, all of that. And you end up creating more connectivity going on through the visceral nervous system. We call it the visceral nervous system or the enteric nervous system. That's the same thing.
Got it.
So you'll hear me flip back and forth between calling it one and the other. It's the same thing.
Perfect.
Now it comes up, and as it starts to go across, called the transverse colon, you're going to come past the liver. Your liver is an unbelievable organ. Your liver actually starts 2 fingers below the bottom of your bottom rib on the right-hand side.
The bottom rib, but not the floating ribs.
Yeah, the bottom floating rib.
Oh, the bottom floating ribs.
The bottom floating rib.
Okay.
Follow it 2 fingers below that.
So it's almost close to the crest of the pelvis.
Close.
Okay.
Yeah, yeah. For some people, the liver may be pulled up. For others, where it's not pulled up, it'll be below the floating rib. So it's somewhere in between there.
Okay.
And boy, if you go on the internet and look, you'll see so many variations of the organs and locations. So note that it is the truth. Everything floats and moves around. So there's good generalities.
Got it.
Okay, and it comes into the middle of your right areola, whether you're a male or female.
Right at the nipple.
Yep, right into the middle of the nipple.
That's huge.
It's really huge. But I'm not done. Wait, there's more. The liver comes across and over onto the left side. Woo. Now, it is amazing how much the liver does. And, how did nature know? We would have so many things in our environment, in our future, that our liver can do such an amazing job.
Yes.
So there's beautiful things that you can do to keep your liver always going, always going. So we say hello to the liver as we come up. And then just a little bit on the right-hand side, how would I say it? If you, as you come up, you'll feel that the gallbladder is right a little bit tucked under the rib on the right side, and it just sticks out just a little bit. Okay? So that's your liver and gallbladder. So we're going to follow the ascending colon and then the transverse colon. Now, I'm taking you across, but for a lot of people, the transverse colon swoops down. It swoops down. So it's not really a straight across. It can swoop down. Okay? Everything is, you've seen pictures of it going across like that. So just with the idea that you're following the area of the transverse colon, looking inside, seeing around it, and the transverse colon comes around and goes around your back and then back down.
Oh, wow.
So there I invite you to notice yourself in 3 dimension.
Mm-hmm.
That it doesn't just go up, across, and down. No. It goes, yep, up, across, behind here, and down. Well, what a great idea to add a little more surface area for your colon for mineral and nutrient absorption. Again, another thing of perfection that nature has created for us. So it goes across and down, and now down here starts to become the descending colon. And again, just touching, listening, using the pads of your fingers as a camera, seeing and noticing the circumference, noticing the quality of the descending colon, and how is your breathing as you're doing this?
For me, it's dropping.
Yeah.
I noticed, interestingly enough, when I was coming up this side, I felt hunger. But only on this side. It's interesting.
Yep.
And then the one thing I'm going to add for maybe the women watching this, right now I have a desire to rip off my bra. But I won't. I won't. But if you're watching this in the comfort of your own home and you're a lady and this is tight, take it off. That would be because that might allow a bit more breathing room.
Well, and especially if a woman is wearing underwire bras.
Yeah.
Right? I wear the little stretchy little t-shirt type, and they're usually hanging off my back, and I don't like anything crunching me in here. But yes, you're absolutely right. And it is interesting. Let's talk about this with the hunger, because you were in the generality area of the liver. And the liver has so much to do with food and hunger.
Okay. Interesting.
The liver is very much associated with appetite.
Appetite. Huh.
Appetite. So when people have no appetite, we can go in and do such beautiful things around the liver. And when the liver starts to do its job properly, we get the proper appetite back. For people who are very, very ill with no appetite, it's the liver.
Got it.
So you were in the area of the liver, and it increased your appetite. It got you thinking of appetite. It stimulated appetite.
Totally. And this will date this video, but last night I broke my toe, and my appetite, as any animal would, goes down when you hurt yourself. So I didn't really want breakfast this morning. I only had a little bit of salad and chicken for lunch, but now I'm like, oh. So.
Yep. You created a nice stimulation. And when we listen to our body implicitly, which Irene, I really believe is what you teach, that we listen to our body and our psyche that is so intrinsically whole together. It guides us when we peel all those other layers aside in the right direction. And then hunger is appropriate. And sometimes not hunger is appropriate. And how beautiful of a gift that is for us to be able to have the gift to listen to that.
Definitely.
So as we go down the descending colon, that wouldn't be so much hunger, because now it's every last bit of extraction of nutrients, and it's now becoming more solid, even more solid, to become a good poop.
Yep.
So in the ascending, it's not solid at all. It's still liquefied. That's still about food.
And then water gets reabsorbed.
Down here is about exit.
Got it.
And so when you get down to the bottom part, so it's just a little bit below the left side of the belly button, the colon often will take a turn in. It'll take a turn in towards midline. Some people, it takes a turn in like this, right? Takes a turn in like this for anyone that does the squatty potty.
Got it.
And then it comes down, and all of this, can you see me?
Yeah.
Okay, because I can't see it on here. So all of this is now the rectum, which is really large. It's like, again, several inches long, which is great. I mean, that's what gives us the ability to be continent, to hold our stool, and again, a little bit last bit of absorption. So when this comes up or it's going down, depending on the person, and we go into the squat, right, to do the squatty potty, or to squat when you're out camping, or to not do a high back toilet, but to do the regular old-fashioned lower toilet. You know, don't get your old parent, please do not get old parents high back toilets. It's the beginning of more constipation that goes in the long run. So that ends up lengthening it out. It opens up that last kink, which then allows poop to evacuate.
Got it.
So you can follow all of this area, and then following the rectum. And you know what I love? I love following my rectum. And I love following the area of my descending colon just as it meets it, because I can barely touch, again, the weight of a grape, that area, and go, I can trigger off a sensation of, I need to poop. And I'm like, good to go, because before I get on an airplane, it's what I'd like to do. I don't want to then go on an airplane and not, or whatever. There's an inconvenient time. There's a convenient time. If I know, I can do that little bit of the touch. It creates a little bit of a pressure in that area, senses. It goes, oh, thank you. And I have a sensation of needing to poop. You go to the bathroom and it does its job.
Got it.
And it's great. I've done this with dogs also, just a little bit of the touch, and then they can go out, they make a good poop. It's life is good when you eat, and life is good when you poop.
Totally. So if someone's feeling this right now and they're like, yeah, I'm not feeling anything, so if you're watching this and what would you say in terms of practicing this?
I would say, first of all, at this point, I'm not asking you to feel. I'm not sure if my head was cut off, so I apologize if my head was cut off in here. So, there we go. Okay, so I'm not asking you to feel it yet. It takes doing it again and again and again. Just like when you were newborn, you didn't immediately go and pick up something and put it in your mouth. Your hands floated in the air. There was a process that happened before, look at baby live.
Yeah. Yeah.
Right, okay.
Yeah. It takes time.
Yes, it takes a little time. Now, I'll tell you, a lot of people can feel it. A little something here, a little something there, not something here, but not something there. And then eventually you do. But everybody eventually feels it
at
through,
some point.
can do something with it. And that's a great gift. And so, would you like to do one more scan through? Normally, I spend about 45 minutes with my students, and we do it like in a few different ways. So I can spend 4 more minutes, take you through that scan.
Let's do a run through.
Good.
Definitely.
So as you're sitting, we'll take a breath. Just allow yourself to feel relaxed, because of course, when you're in this nice state, this is the state in which your body can digest.
Yes.
Which is a gift. So we take our hands and we use our pads of our fingers. You can close your eyes or have them open, but that you're looking a little bit inside your mouth before you even touch your mouth until you get to the point where you can touch your lips and look in your mouth into your face, down your throat, and you can touch, following maybe the weight of the skin of a half of a grape.
Half of a grape. Mm.
Half of a grape skin. Just looking inside, following down your swallowing tube until you make your way all the way down to your stomach, which is a little bit to the left. And your stomach is about the size of your fist. See.
And it's not covered by the ribs.
No.
It's exposed.
It's exposed. If it were covered by the ribs, there would be a name for that. And likely that person is more towards a hiatal hernia because it's pushing up. So we want it to float a little bit down. We don't want it to float too much down. We just need it to be where it's not being pulled up or sagging.
Mm-hmm. Okay.
Yeah. And more likely people it's pulled up because of, yeah.
Got it.
So we find and say, nice, the stomach. And at the bottom of the stomach is a valve in which the partially beginning digested food starts to just drop little plops down through that sphincter that opens and closes down into the beginning of the small intestines.
What's the name of the sphincter there again?
Pyloric valve.
Pyloric valve. Right.
Pyloric. The pyloric valve. And so when the gallbladder and the pancreas meet with their tube and they drip down into the same tube, down into the beginning of the small intestine where the pyloric valve meets into the small intestine, the food, the gallbladder can squirt bile into it, and the pancreas can squirt digestive enzymes.
Right.
Now, you might ask, how does the pancreas know? When the food goes into the small intestines have little finger-like projections called villi. Those villi have unbelievable neurochemical receptors that say, oh, there's this kind of food in there.
Protein, fat.
Yep, might be protein, fat, carbohydrate. So it depends on what's in there, that it sends the neurochemical transmission back to the pancreas and tells the pancreas, I got more carbohydrates in this meal, so it'll send out digestive enzymes appropriate to that. And it may say, well, she had a big hamburger too, so there's fat in there. The pancreas can send out stuff to break down the fat, but the gallbladder then sends out stuff to break down the fat. Okay? So that's how that communication happens. The length of our small intestines is just so good for us because that's where that liquefied food and meeting of chemicals and probiotics and our good bacteria meet to break it down more, and then it travels information back up to the pancreas and gallbladder saying what to send out. So there's this constant communication of a beautiful highway of transmission of information that goes back and forth until it eventually makes its way down. 2 fingers down below the belly button and 2 fingers over to the right, and it goes to the ileocecal valve, another sphincter that opens and closes and lets the liquefied digested food to go in and start to go up the ascending colon. The job of the small intestine is for it to be 100% liquefied. The job of the large intestine is to start to take out the water and last bits of minerals, maybe some vitamins, but the last bits of minerals, and to solidify it. So it goes up goes around the area of the liver. Hello, liver, you're doing such a great job. And then it transverses across. And then it goes around our back for a little more extra surface area, length, and starting to go down the descending colon until it V's out toward your midline, and then down the rectum, and then out. Now, I will say it is so important that we understand it's pretty simple. When we respect our organs in this way and the richness of the nervous system that feeds back and forth between these tube systems, and they can do their job, I believe what a healthier group of people we can be, physically and mentally. And you can follow your own tube system from here to here, all the way down. And what does it mean that when you take a moment before you put food into your mouth?
To tune into that.
Tune into that. To look across the table to someone and say, it's good. This is good. Life is good. The moment is good. Or if you're sitting by yourself, to say, it is good. And this system is now welcoming our food and welcoming our nutrients, and it does its integrity of moving and doing the viscera to function in their job that no medication and no person can fix, but its system recorrects, realigns with integrity to take care of you because it's designed to be that way.
Exactly.
And this is just a piece that's beautiful to remind you of that. And remember, it's not just for you, it's for your animals too.
Yes. That's another
moment
video.
of mindful. That moment of mindful. And so
cool.
I give this gift to all of you, and I hope that you use it because it is a pleasure to be able to eat differently. It's not about a technique, but it's about knowing how you are, you, each one of you, inside, and how your nervous system functions in this way and takes care of you. And you'll notice this connection and everything that you do with Irene to make all of this better becomes another notch even better.
Cool. Thank you so much. Yay. Yeah, this is great. So for those of you watching, obviously practice this, watch this again. I think we went through pretty slow, but if you need, reminders, go back, listen, and let us know what happens. Hey everybody, I had a question for Elinor after we completed this tracing of the viscera, the enteric nervous system, and I didn't want to interrupt her teaching. And I kind of understand this and have my ways of answering this, but my question to Elinor is, why do we even need to do this if our body knows how to do this? So from a nervous system perspective that we're learning, our nervous system gets dysregulated. And then the valves don't open and close, or they stay too open, or they stay closed. So what's your way of answering that question? Why do we need to do this? How come our bodies just don't do it on its own?
There's so many ways to answer that. And so I'm going to do the Vulcan mind meld, however that looks like. But I'll give you a couple of answers. Is, like you said, dysregulation of the nervous system. We live so much in every society, really, in fight and flight or startle. There's so much with startle. Yeah. Somebody put on Facebook this morning, somebody going a 5-minute video of every time saying boo to their father and him, in his Irish accent saying, oh, fuck you, responding back. And and at the end, and the person said, "Isn't that funny?" And I wrote, "Absolutely not.
Mm-mm.
It is not okay to live in a frightened mode. I don't find it humorous at all.
Yeah.
So much of television brings us into this. The news brings us into this. Driving brings us into this. And what happens when that state of fight and flight takes place, it draws up the viscera too, or it clamps the viscera. So there's a drawing up in this,
Yeah.
or there's a clamping down for some people, down like this.
Shutting down.
And eventually it becomes connective tissue pulling. See, so you can say the nervous system starts,
Yeah.
the connective tissue gets involved in pulling down. How is it that some people get the scar tissue and they didn't even have surgery and they're getting adhesions?
Right.
Right? So we can look at it from all of those, from those perspectives, that what is stress do to us? What is perceived stress do to us?
Yeah.
Okay, let's be honest. It's the state of life.
Yeah.
And if in Feldenkrais we're looking at just doing, okay, move a little, oh, now I'm sitting in the middle, didn't even realize all day I was sitting like this. Well, how lovely that at the end of the day, you can be sitting easily like this. And then at the end of 10 years, and the end of 20 years, and the end of 50 years, and 80 years, and 90 years, and you're the person walking like this without a walker, or, while everyone else who went like this, and didn't notice the end of the day.
Yes.
So I'm saying, don't just notice the end of the day. I'm saying, notice.
Yes.
And in those little bits, it constantly regulates. Life is not designed to be regulated perfectly.
No.
But it is designed for us to have the wherewithal, the ability to think and create that ability for integrity, that our body can go back and forth between one system and the next in a healthy way.
Yeah.
Then the body works. Let's say another example. A person goes to another country and they get traveler's diarrhea. That can throw it into dysregulation.
Yeah.
Maybe they pick up a parasite. Maybe they had a stomach flu, whatever that means.
Food poisoning.
Food poisoning. See, all of those things can throw it into dysregulation. But it's not just diarrhea. The nervous system of the gut gets thrown off kilter. And so this can calm that and bring that back into a state of regulation quicker, more easily. And it doesn't have to become one thing after the next. Anybody that knows that anyone that's had something that's happened with the viscera, it becomes repetitive.
Right.
There becomes a memory. So this allows for it to not become that memory and that negative pattern.
Creates a new pathway.
And a very healthy, functional pathway.
Exactly. Do you have time for one more question?
I do.
So we've been talking about the digestive system, digesting food, getting all the vitamins and minerals out, etc. Probiotics that are in the gut. I bet there's some people wondering, how come you haven't talked about food and the right? And this is a longer conversation, but as a teaser, whenever there's problems with the gut, everyone comes in and they're like, I've been on this diet, I've seen this naturopath, I've eliminated wheat and gluten and da-da-da-da-da-da, and they're still not well. And I know, again, it's because the nervous system is still dysregulated. But I also know that you are very big on your food.
Yeah.
So it's both.
And I'm very big on food choice.
Yeah.
So when people say, it's only this diet, only that diet, and, today somebody put out, okay, well, and then it's back to only the China study, and it's only to eat that way. And I wrote to her and I said, there is no one way of eating that is the right way for everybody. And then she says, well, what do you think then about fermentation? And I said, while my body loves fermented foods, it depends on the genetic components for each person Because if a person already has a lot of yeast inside of them, you don't want to give fermented foods. You're going to feed that yeast and their toenail fungus and their yeast in their gut and their thrush in their mouth and the fungus in their ears. All of that just grows more and more. So that's one component, right? But the other part is if there's a genetic piece to that that doesn't do well with fermented is not their thing.
Exactly.
Right? So, and some people, you know, I believe a small population can do well being vegans or doing raw food, but that's not everybody.
Small population.
And God bless everyone who doesn't want to cause animals to die to be eaten, but don't do it to forsake your own health.
Yes.
Right? There's laws that we make in Judaism called the laws of kashrut, of being kosher, and that means being ethical in the treatment of animals, that they live a very good life till the very last moment, and that their needs are taken care of, very, very importantly so, till the very last moment, right? Yeah. So it's looking at it from there. How much do we eat? How are we combining the food? I can combine it differently than the next person next to me.
Yeah.
And I respect that. And I ask people, listen to yourself before you bite into this food. What does your body say?
Yes. Thank you. That's perfect. And this is part of learning to listen to the gut impulses, because, and practice this. This will be my final tip for everyone watching this. Start to cultivate and hone your natural impulses for what you want. If you go into your fridge and you go to grab the everyday smoothie you drink, but you're like, oh, I'm craving some toast and some eggs, do that. Just because the diet plan has said you have to have a smoothie, maybe your system needs some solid food that day.
That's right.
Or maybe it's the opposite.
That's right.
And, you know, the other day, Seth and I were somewhere in a lineup, my last story, and he was going to order a coffee, right? And his belly said no, like he felt a pull. And so he had tea, I had a decaf, and it was all good. But he knew that if he had had that coffee, his system was saying,
Absolutely. And I had that same thing happen this morning. I started boiling an egg because I thought, oh, I know how my day is going to be. I'd like a soft cooked egg. I don't fry eggs, by the way, because that turns into arachidonic acid. That's for another time. Yes. I was soft boiling an egg. And while it was boiling, I went and looked at it, and it just went, not gonna happen.
Yeah.
So it didn't feel right. And I thought, well, I've got 2 dogs. So I took the egg out, split it in 2, gave it to both my dogs after they finished their breakfast, and what a treat it was for them. And for me this morning, organic milk, believe it or not, dairy, yes, with a frozen banana with chia seeds was beyond delicious, with a slice of Ezekiel bread and almond butter. And my body went, dancy, dancy, happy, happy.
Yeah.
I'm beyond happy.
Yeah.
If I would have taken the egg, it would have been, and yet, I thought I wanted it because I planned it in my mind last night.
And you might want it tomorrow. So it's so cool. Awesome.
Listen to yourself.
All right.
It's the greatest gift.
If you're still listening to us banter, thank you for still being here. We could do this for 4 more hours, but we won't. Another time.
Another time in a workshop we can.
Yes.
Yeah.
Love you, darling. Bye.
Bye-bye.